My name is Shaylee Shea, and I am the Director and Health Officer for McPherson County Health Department. We are an entity based in the city of McPherson, but we serve the entire county, and we have different health service programs like family planning and WIC and immunizations for both adults and children. And we also now have Healthy Living Labs, which is a self-pay lab service, so that routine labs that typically people would get at their doctor's office is a bit more affordable here. We have the Underserved Health Services program that is relatively new to our department. We were awarded a $10,000 grant from the Mastermind McPherson County project to fund and start up this program. It really came to life when we started working with the McPherson County Jail to offer services to the inmates. And we really just wanted to build that trust with inmates so that after their incarceration, they would come back out into the community and feel like they had a trusted health professional that they could come to. So it started there, and it quickly snowballed into offering funding assistance for adults who don't have health insurance but fall at 100 to 200% on the federal poverty guidelines. We just in the last year, a year before we got the grant, we had over 200 adults that would have qualified for this program. And so we knew right away after the Mastermind project came out that we wanted to apply and see if we could work to lower that number and help adults in our community out. So the $10,000 that we received from the grant really helped start the program because it allowed us to dedicate staff time to meet with our key partners in the community to get the program started. It also allowed us, so far to date, we've helped 33 individuals with the funding. So health services like immunizations and family planning and lab services that they otherwise would have had a bill for was either covered completely or covered to a more affordable price for them. A lot of times at the health department, we have funding for children and, a population that is younger than 19. We have programs like VFC, which is going to provide free immunizations to children that qualify for that, people that qualify for Medicaid. We obviously have a massive gap of adults that are in between that. Either they make just enough money that they won't qualify for Medicaid, but they don't make enough money to afford marketplace insurance. So we wanted to address that because a lot of times those people come to us. We have a sliding fee scale for most of our programs, and a lot of times what we charge them is more affordable, and we do accept payment plans and things like that, but vaccines can get very expensive very fast. And there's only so much we can do as a county entity. And so this funding really has helped us kind of approach that gap and say, where can we meet you at? We want to meet you where you're at. And even if it's not, we're giving you a free service, we're significantly reducing it and working with you so that you don't feel like it's a burden based on what your financial ability is.